Hi, I'm going to be reviewing post-op care for eyelid and eyebrow surgery. The most important thing you want to do in the post-op period of time is, as quickly as possible, you're wanting to reduce the swelling that goes into the lids. The lids are designed to protect the eyes, and as long as there's swelling in there, they won't close in a normal fashion, and therefore put the eye at risk to become dried out and injured. And that can affect the vision very appreciably. In fact, one day of getting behind on lubrication can take at least 3 weeks for the vision to recuperate. So what we want to do to reduce the swelling out of the lids as soon as possible after surgery is apply cold, pressure, and head elevation. And by head elevation, I mean that the head needs to be between 45 and 90 degrees at all times, except when you're changing out cold packs or changing out the eye pads, which I will be describing soon. After 48 hours of the head being only 45 to 90 degree angle and going through the measures that I'm going to be speaking of very soon, whenever you can have your head elevated, you should. So putting an extra pillow under your head at nighttime is great. Sleeping an extra period of time in a recliner is even better. Cold packs whenever you're able, all those things are going to be helpful. So the first thing I'm going to do is review what you need to do a total of 4 times a day for the first 48 hours. And 4 times a day is easiest to think about it being breakfast, lunch, dinner, bedtime. 3 meals a day and bedtime. What you're going to do is you're going to take 2 iPads, and we will provide you more than enough sterile iPads. You're going to want to open the sterile iPads in a sterile fashion. So you open up the top where the leaflets are, and then you want to very, very carefully break the seal of the glue. And then I do what I call a little wiggle, wiggle, wiggle movement to try to open up the iPad covering slowly and carefully so the iPad doesn't fall out on the floor. And I do it in a very careful way. If you just take your thumbs and open it, you'll tend to tear off a strip, and then that puts everything at risk for contamination. I'm going to have 1 iPad for each eye. The same thing is done if it's an eyebrow surgery up in the forehead. And now what I'm going to do is take sterile water. We will supply you with what is left of the sterile water from your surgery. You will have been instructed to have a jug of distilled water. After you finish with the sterile water we provide you, you can pour some of the sterile distilled water into this jug, and it'll be easier to pour than out of the gallon. I'm going to make sure that as I'm pouring this, I do not touch any part of the bottle or the lip to the iPad. Close over the cap immediately. And in case I have too much water on this, what you should do is cover them, flap back over it, and squeeze it over a garbage can. And I did not put too much water because there's nothing coming out. And the reason is you don't want somebody to experience a drippy wet. You just want it to be wet. Why do we want iPads that are sterile with sterile water over the incision sites? That is because moist cold penetrates deeper than dry cold. Additionally, if a scab is forming under sterile conditions, there's no need for me to have to add antibiotic by mouth. It's a nicer way for you to go. Additionally to that, when you go to remove the iPad, if it was dry, the scab could be stuck to it and you would unroof the scab as you're taking off the iPad. So a moist, sterile iPad is the best way to go. The other thing is, and most people will have Tobradex, some of you Maxitrol ophthalmic ointment, and some people I may have to even come up with something else depending on if you're allergic. Tobradex is the best, Maxitrol second best. The ointment, what you'll do is you're going to put a small amount into the eye 4 times a day, breakfast, lunch, dinner, bedtime, about 1/3 of an inch in each eye. What you do is you take off this you want to make sure you never touch your finger to the incision site. So you pull the lower lid down, which is easy to do even with a lower lid lift. You put a little ointment right on the inside of the lower lid, and then you flick the wrist. You can see it's coming out just from the heat of my hand. You would do the same thing to the other side. A flick of the wrist right on the edge of that lid margin will break the stream of ointment coming out. And after about 1/3 of an inch is in each eyeball, you would then take the lower lid and you would push the lower lid inward and upward so that the lower lid forcibly meets the upper lid, and that will cover the eye in such a way that the ointment is giving a nice bathing of the front of the eye to keep it moist at all times. The next thing you want to do is you want to take these sterile eye pads moistened with the sterile water. You want to pinch them up so that the underside is still sterile. I'm going to do it with the other side. And now I'm going to put these over the closed eyelids of my model here, and then I will ask him to please place his hands over the top. The part I'm holding doesn't have to be sterile. The underside is sterile. Close your lids, please. And we're going to put this right over here like that. Now, if you wouldn't mind putting your hands over the top. Good. Now I'm going to take a bag of frozen peas or corn. I'm going to put it into a knee-high pantyhose. We will be supplying you with this. We'll apply you the first bag of the peas or corn, and then we expect you to supply other ones that hopefully you have at home. I would recommend a minimum of 10 Ziploc snack size Ziploc baggies of frozen peas or corn. After I put it in, and I'm going to put it about 1/3 of the way from the open end, and then I kind of cinch up in the middle so it's like a dumbbell so that there will be no peas or corn. Maybe put, good, now put your hands over the top of this. I'm going to travel around, and I'm going to, this will be real tight for just a little bit, and that won't be as bad. I'm going to tie a knot, and I'm going to make the open end the loop. So just like you were tying a knot, you want to come over this way maybe and see it? Carol, good. And then I'm going to push, and the loop, I'm going to push this through here and pull on the toe. Now, why did I put the knot on the side? This way, you can put your hands down. It stays in place, and if he's laying back on with a pillow, the knot isn't back there making his head wobbly. In addition to that, when you go to do a cold pack change and you don't have to do a whole iPad change, it's much easier to do. Now, while the iPad changes with the ointment are done with the fancy schmancy Tobradex or Maxitrol every, 4 times a day, breakfast, lunch, dinner, bedtime, the cold pack changes are done every 2 hours. So let's pretend it's 2 hours from now. You will take out of your freezer a Ziploc baggie of frozen peas or corn, and you will put it, you may have to wrap it on your countertop or break it up so that any crystals of ice are broken up so that it's nice and pliable. And then I'm going to ask my model here to put his head backward. Most of the time you could actually put the head all the way back and have him flat for the 2 minutes while I'm doing the cold pack change. What you would do is pull this open area and pretend his head is on a pillow. And if I pull the opened one, I don't even have to take his head off of the pillow. I can simply, if his head is back, all the way back like he's on a pillow, swing this over. And then I can take out the thawed pack, put in the fresh pack, squeeze it in the middle so it's cinched up again, and lay it right back over this, and then retie it. I want to mention also that in between, when you do the cold pack change, while you do not need to use the antibiotic ointment you paid for, which is expensive, just to make sure the eyes are lubricated, since you cannot over lubricate the eye, what you can do is take your over-the-counter eye lubricant ointment, gently pick up the lid, pull the lid skin down like this, look up, look, and then put a little ointment, and then close your eye. covered back up. Let's say the person has to go to the restroom just 1 hour after you changed out their cold pack. What you would do is that's the one time the person is allowed to take off their cold pack and everything, because most people like to take care of themselves when they go to the restroom. So at that time you would take off the entire cold pack. You would take off the eye pads, pinching them in the way I just did. The underside is still sterile. You would place it in the leftover little cover, because we never did touch inside of there, so it's still sterile. When the person comes back after having cleaned their hands, going to the restroom, and did not touch their eyelids or the surgery site, then the side that has a little bit of blood is actually the sterile side. That is the same side that should go back on them. Obviously, if there's a lot of blood, then just get a whole fresh eye pad. Generally, people will have bleeding the first 48, sometimes 72 hours after surgery. The majority is in the first 24 hours. So again, the cold pack changes are done every 2 hours, round the clock for 48 hours. And the eye pad changes are done 4 times a day, breakfast, lunch, dinner, bedtime, with the prescription antibiotic ointment. And in between applications of the expensive antibiotic, when you're doing the every 2 hour cold pack change around the clock, you can gently lift up the lid, pull down the lower lid, and put in a little squirt of the ophthalmic ointment. Those are the most important things. Now we're going to talk about other things that are practical. When you want to go and you'd like to wash off your face, in the first 48 hours you cannot go in a shower that would cause you to get splashing of the face, because you're at too high a risk for infection. So you can take a shower if you have a handheld to keep at your chest level or lower. You can use facial wipes or baby wipes to wipe your face just as often as you want, but not over the incision sites. And the other thing for you to know is that as far as shampooing goes, I would recommend a dry shampoo in the first 48 hours. After that, until I take out the sutures, you need to keep the suture site clean and dry. If the suture site gets too wet, it will unroof the scab, and then there is high risk of infection. So every time you go in the shower, until the sutures are removed, after the first 48 hours when you're not allowed to go in there, you take a clean, dry washcloth and you wad it up and put it over your closed lids or over your forehead if that's where the incisions were. And that it will, even if a little bit of water gets on it, it'll protect it. Folding the washcloth actually causes a person to more likely get water behind the washcloth onto the site than just wadding it up. The other thing is the cold packs after 48 hours will still help you. So anytime you can use a cold pack, you should use a cold pack. But instead of being like a hostage where both eyelids are closed over, what you will do is switch to what I refer to as the pirate look. So you would take the cold pack, you would put it over just one eye, opposite forehead, same size ear, or vice versa. And you would do that when you're watching TV, washing dishes, doing some other kind of work around the house or cooking. Anything like that, you can do it as a pirate. You just can't do it as a hostage. When you go to bed at night, the very last thing you should do before you go to sleep is put a cold pack over your eye. Because you're falling, you're going to sleep, having your eyes occluded really doesn't make a difference. And because your head is closer to the level of your heart, your lids are going to swell more when you're asleep. Therefore, you want to use cold packs. Now, it's really nice to have a cooler by your bedside so that you can take the cold pack and just sling it into the cooler if you wake up in the middle of the night and you're noticing that you're smelling thawed peas or corn instead of stepping out. So that's a help. Also, a lot of people like to bring the cooler with them in the car with extra cold packs. So if they go grocery shopping or something like that where they don't have the cold pack on them, they'll notice their eyes will start to burn and tear due to the dryness as their lids are swelling in that first week after surgery. When they get back into the car, they should lock themselves in, take a cool pack out of the cooler and place it over their eyes. In 5 to 10 minutes, they'll notice the burning and fire is out of the eyes feel better, and then they can drive home. I think that that's pretty much it. I do want you to ask us any questions that you have, and feel free to call the office or me at any time for confirmation on whether everything is going as expected. Alrighty, thank you. It's been our pleasure to help in this life-changing surgery. So please, please let us help you more if you feel you need some. Bye-bye.